What if the health condition they've been managing for years is quietly leading to dementia? Not tomorrow, not next year, but slowly, invisibly, it's changing the brain. There's no memory loss, no confusion yet, just subtle shifts in the background, a little more brain fog, a little more fatigue, and by the time anyone realizes what's happening, the damage may already be done. In this video, we'll expose 9 health conditions common in seniors that are directly linked to dementia. Many of them are considered manageable or normal with age and are often brushed off. If you or someone you love has even one of these, you deserve to know what's happening before memory starts to disappear. Let's begin with number 1, untreated hearing loss. Phyllis, 71, had been told by her audiologist that she needed hearing aids, but she insisted she could get by just fine. 4 years before her diagnosis with Alzheimer's, she began showing signs, asking people to repeat themselves and slowly pulling away from social situations. Over time, it got worse. One afternoon, she spoke to her grandson as if he were her husband, who had passed years ago. That's when her daughter scheduled a full evaluation, and she regretted waiting until it got that far. Studies show that untreated hearing loss increases the risk of dementia by up to 300%. As sound input fades, the brain works harder to keep up, draining mental energy from memory and decision-making. Over time, this constant strain can shrink areas tied to language and short-term memory. It doesn't stop at forgetfulness. Many begin to withdraw, misread conversations, grow suspicious, and eventually become severely confused. What starts as hearing loss can quietly evolve into isolation, paranoia, and cognitive decline. Number 2, chronic depression. Glenn, 78, had struggled with severe depression for years after his wife's passing. He was taking several different medications for it, but still spent most days lying in bed with the curtains drawn. Over the years, he began growing weaker and more forgetful. Then one afternoon, he unplugged all the lamps in the living room and hid them in the closet, saying their light felt too judgmental. That's when his son scheduled a doctor's visit. It took 3 years before he was diagnosed with vascular dementia. Doctors now understand that long-term depression does more than cloud emotions. It slowly alters the brain, weakening memory, shrinking decision-making centers, and speeding up cognitive decline. The longer it goes untreated, the deeper the damage runs. When grief becomes strange, and the mind starts rewriting logic, it may not be depression alone. It may be dementia rising beneath it. Number 3, sleep apnea. Jacqueline, 80, had been warned about her sleep apnea for years. She gasped in her sleep, snored loud enough to shake the walls, and often woke up feeling like she hadn't slept at all. But she always laughed it off. "I've been snoring since Nixon was president." Then, 2 years later, came the moment no one could laugh about. She put her keys in the dishwasher, then spent 2 hours searching the freezer until everything inside melted. That's when her daughter pushed for a full evaluation, which confirmed it was Alzheimer's. A major study found that sleep apnea disrupts the brain's ability to enter deep, restorative sleep, the critical stage when memories are processed and toxins are cleared out. Without it, the brain begins to accumulate damage night after night. In fact, people with untreated sleep apnea may develop dementia up to 10 years earlier than those without it. When the mind starts breaking in daylight, it's often because it's been drowning in silence all night. Number 4, vitamin B12 deficiency. Bruce, 68, had been told during a routine checkup that he was dangerously low on vitamin B12. The doctor recommended dietary changes and supplements, but Bruce brushed it off, joking, "At my age, I'm lucky I remember to eat it all." Over the next 2 years, his family noticed his thinking seemed slower. Then came the moment they couldn't ignore. He tried to heat soup in the washing machine. His wife called the doctor that same day for a neurological referral. He was diagnosed with Alzheimer's a few months later, and his wife blamed herself for not catching it sooner. Research shows that vitamin B12 plays a vital role in brain health, protecting nerve function and supporting memory. A deficiency can mimic or worsen dementia, and in older adults, the damage can escalate quickly if left untreated. When simple nutrients are missing for too long, the mind doesn't just slow down, it slips through the cracks. 60% of dementia cases are linked to pre-existing health conditions. That means the brain often doesn't break down on its own. It's pushed there, slowly, by years of silent damage from other health problems. Whether it's hearing loss, diabetes, sleep apnea, or depression, these conditions don't just affect the body, they rewire the brain. And most people don't realize it until it's too late. If you or someone you love is living with any of these conditions, now is the time to act. Get a full checkup, review medications, push for answers. Because once memory begins to fade, prevention becomes much harder to reach. Number 5. Type 2 diabetes. Carla, 75, had been living with type 2 diabetes for over a decade. Her doctor warned her about the long-term effects on her brain, but she struggled to manage her diet and often forgot her medications. Over time, she started confusing familiar faces. One day, she set the table for dinner, with forks in the toaster and napkins in the medicine cabinet. That's when her son scheduled a full cognitive evaluation, and Carla was diagnosed with Alzheimer's disease. Studies have shown that uncontrolled diabetes increases inflammation and damages blood vessels in the brain. It also disrupts insulin signaling, a process the brain relies on for memory and thinking. Some researchers now refer to Alzheimer's as type 3 diabetes because of the strong metabolic link. When blood sugar is unstable for too long, it's not just the body that breaks down, it's the mind. Number 6. High blood pressure. 4 years before his Alzheimer's diagnosis, Rick, 77, was warned his blood pressure was dangerously high. He promised to take his medication, but often skipped doses and shrugged off follow-ups. Over time, his family noticed small lapses. He repeated himself, misplaced things, but then it escalated. One day, he was caught talking to the news anchor on TV, convinced they were speaking directly to him. That's when his wife called the doctor for an immediate evaluation. She later said, "We thought we had time to fix it. Turns out, time was already running out." Studies have shown that uncontrolled high blood pressure damages the tiny vessels that supply blood to the brain, leading to shrinkage in areas that control memory, judgment, and emotional regulation. It's one of the leading causes of vascular dementia and a major risk factor for Alzheimer's. Number 7. Chronic inflammation. Charlene, 69, had been diagnosed with rheumatoid arthritis years earlier. Her joints ached constantly, and flare-ups left her exhausted, but she resisted taking anti-inflammatory medications. "I hate relying on pills," she told her husband. Over time, her thinking began to shift. She started writing grocery lists in mirror image, every letter perfectly backward, and claimed it helped her hide them from strangers. Her family took her in for testing, and she was diagnosed with frontotemporal dementia soon after. Studies link chronic inflammation, especially from autoimmune disorders, to degeneration of brain tissue. Inflammation releases chemicals that wear down neurons, disrupt mood, and impair memory over time. The longer it's left unchecked, the deeper the damage runs. What starts in the joints or gut doesn't stay there. Inflammation has a way of reaching the brain and changing who someone is. Number 8. Atrial fibrillation. 3 years before his diagnosis with Alzheimer's disease, Ralph, 76, was diagnosed with atrial fibrillation, His heart would flutter unpredictably, leaving him dizzy and drained. He hated the way the medication made him feel, so he stopped taking it and told no one. For months, he was doing fine, just seemed a bit tired. Then came the bizarre moment that changed everything. He began covering windows with foil to block the spies. His wife immediately booked a neurological evaluation. After the diagnosis, she said, "I thought it was just his heart acting up again. I never imagined it was his brain." Studies show that AFib reduces blood flow to the brain, especially during irregular heart rhythms, increasing the risk of strokes, silent infarcts, and long-term brain damage. It also disrupts oxygen delivery, which accelerates cognitive decline. When the heart falters, the brain often follows, and the connection can be devastating if ignored. Number 9. Frequent urinary tract infections. Nadine, 83, had dealt with urinary tract infections for years. They'd come and go, sometimes twice a month. Her doctor warned that frequent UTIs could affect her cognition, but she didn't believe it. "It's just a bladder thing," she'd say. But over time, her forgetfulness gradually worsened. Then, one morning, she reported her own dog to 911, certain it was spying on her. She spoke calmly and clearly and refused to hang up. Her daughter rushed over and took her straight to the hospital. Her dementia diagnosis came later that year. Experts confirmed that UTIs can cause sudden, severe confusion in older adults, even without fever or pain. Repeated infections trigger inflammation, disrupt the body's chemical balance, and can lead to permanent cognitive changes when left untreated. When thinking begins to unravel during routine infections, the brain isn't just reacting, it's warning you that something deeper is happening. Dementia doesn't always begin in the brain. Sometimes it starts in the body, in conditions that go unchecked for too long. If something feels off, trust your instincts, because the earlier you act, the more of them you might save.
And there you have it. What are your thoughts? Next, dive into this video for more essential tips to transform your health and help you thrive. You're going to love it. Thanks for watching Healthy End, and we'll see you there.